Okay. All right. I'm going to start with Andrea. Andrea, read for me, please.
Hospitals are organized into specialized areas and departments designed to deliver efficient and safe patient care. Nurses must understand departmental functions and accurately describe patient location, destination, and movement. Effective communication about hospital areas supports timely care, reduces delays, and prevents errors during transfers and handovers. Standardized terminology ensures clarity across multidisciplinary teams, especially in international healthcare environments.
All right. Very good, Andrea. Can you tell me what does the word handovers mean? Handover. What does that mean? What significa handovers?
Seria passagem de plantão?
Very good. Gente, desculpa, você pode estar ouvindo essa tossindo, né? Eu tenho um tosse muito grande. Okay? All right, so handover, sensory in the plantão, okay? All right, so basically what we're looking at is hospital areas and departments. All right? Our grammar focus tonight is going to be on prepositions. So pay attention. All right, so that was Andrea. I want Victoria. Por favor, lay para me, chocolate lady,
Hello, teacher. Can you hear me?
as I can.
All right. Hospital areas and departments. Hospitals are organized into specialized areas and departments designed to deliver efficient and safe patient care. Nurses must understand the departmental functions and accurately describe patient location, destination, and movement. Effective communication about hospital areas supports timely care, reduces delays, and prevents errors during transfers and handovers. Standardized terminology ensures clarity across multidisciplinary teams, especially in international healthcare environments.
Very good. Very good, Victoria.
Thank
Carol,
you.
Carol,
Hello.
can you read for me?
Hospitals are organized into specialized areas and departments designed to deliver efficient and safe patient care. Nurses must understand departmental functions, are accurate, describe patient location, destination, and movement.
Again, from here. Nurses,
Nurses must understand department functions and accurately
departmental,
departmental functions are accurately
and accurate.
and accurately describe patient location, destination, and movement. Effective communication about hospital areas supports timely care, reduces delays, and prevents errors during transfers and handovers. Standardized terminology ensures clarity across multidisciplinary teams, especially in international healthcare environments.
Very good, Carol. Tum 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 tum. Brenda,
Okay, teacher. Um, okay. Hospital areas and department. Hospital are organized into specialized areas and department designed to deliver efficient and safe.
design. The G is silent. Design.
Okay, so designed to to deliver efficient and safe patient care. Nurses must understand the departmental functions and accurately describe patient um, and describe patient uh, uh, destination location and the
Movement.
yeah,
Movement.
yes, movement and um uh,
Effective.
okay, an effective communication about the hospital areas support timely care and reduces delay and
Delays. Reduces delays.
okay, and prevents errors during transfer and handovers. Standardized terminology ensure clarity across multidisciplinary teams, especially in international healthcare environments.
Environments. Very good. Oi, Marcele, seja bem-vinda, tá? Ok. Andresa,
Oi.
lê para mim?
Okay. Hospitals are organized into specialized areas and departments designed to deliver eff- eff- efficient, como é que é?
Efficient.
Efficient and safe patient care. Nurses must understand departmental functions and accurately describe patient location, destination, and movement. Effective communication about hospital areas supports timely care, reduces delays, and prevent errors
Errors.
errors during transfers and handovers. Standardize terminology ensures clarity across Oi? Clarity okay. Across multidisciplinary teams specialize in inter- international healthcare
Especially.
especially in international healthcare environments.
Environments.
Environments. Okay.
Okay, very good. Very good, Andresa. Daisy,
Hello,
hello.
hospital areas and departments. Hospitals are organized into specialized areas and departments designed, not teacher,
Design.
designed to deliver efficient and, safe patient care. Nurses must you understand
Understand. Understand.
understand. Isso me pega ainda. Viu? Departmental functions and accurately describing patient location, destination, and movement. Effective communication about hospital areas supports timely care, reduces delays, and prevents errors during transfers and handovers. Standardizing terminology ensures clarity across multidisciplinary teams and specialize in
Especially
especially in international healthcare environment,
environments.
environments.
Nossa, Disney. Oxi,
Oh, teacher, thank you. Fico feliz.
nossa. Parabéns, menina.
Obrigada, teacher.
Ok, Karina.
Hospitals are organized into specialized areas and departments designed to deliver efficient and safe patient care. Nurses must understand departmental functions and accurately describe patient location, destination, and movement. Effective communication about hospital areas supports timely care, reduces delays, and prevents errors during transfers and handovers. Standardized terminology ensures clarity across multidisciplinary teams, especially in international healthcare environments.
Environments. Very good. All right. Vou esperar. Atenção, Marcele e Arlene Galês. Só um momento. Só um momento, gente.
Ai, me acharam aqui, né?
Não, deixa.
Cadê? O Titir sumiu aqui?
Oi?
Sumiu?
Não. Vou fazer uma coisa aqui.
Oh, que lindo.
Assiste esse vídeo para mim, rapidinho.
Hello, this is Dr. Eric Bricker. Thank you for watching A Healthcare Z. Today's training session is on how hospitals really work, clinical training for non-clinical healthcare professionals. Now, thank you so much for being here today. This is my favorite time of the week, is to be able to speak with all of you, or at least meet with all of you virtually. Let's go through some of the different departments in the hospital. You've got radiology, where you've got CTs, MRIs, X-rays, PET scans, and GIs, and GI radiology. So that's like where you swallow contrast, like barium, and then they take X-rays of the barium to see how it's flowing through your gastrointestinal tract. That's done through the radiology department. Then there's interventional radiology, which is where they actually do, and interventional radiology actually looks a lot like this. So this is actually a cardiac cath lab, but interventional radiology looks the same way. This right here is what's referred to as a C-arm, where you can take actually movies with an X-ray. You can barely see it, but this is an actual TV screen where you can see a movie. And this is where the interventional radiologist is using the imaging to stick drains in like abscesses to drain the pus without surgery, or to take biopsies, let's say from a part of the piece of the lung, and they're using the imaging to guide where the needle goes into the lung to take the biopsy, or place what's referred to as an IVC filter, which is an inferior vena cava filter, which is a very common procedure at a hospital. When people have what's referred to as a DVT, a deep vein thrombosis, which is a blood clot in their legs, it breaks off and then goes to the lungs, which is then referred to as a pulmonary embolism, and that is potentially lethal. People die from pulmonary embolisms. And not everybody who has a DVT and a pulmonary embolism requires an IVC filter to basically, if any more clot breaks loose from their legs, the filter in their large vein of their abdomen actually catches that blood clot before it then travels further to the lungs, preventing the pulmonary embolism. So I won't get into detail anymore about that, but just know that that's a common procedure that's done by the interventional radiologist as well. And then, of course, there's cardiac catheterization. This actually is the cardiac cath lab, and there's most likely the cardiologist here. There's actually a patient underneath this blue drape. This person here is called the circulating nurse, and this person could be another cardiologist or could be an assistant or a PA. And this is where the person lies flat, and they actually enter the person's artery through their groin, and then they snake a catheter up through their artery into the left side of their heart. And that's where they can actually go into the coronary arteries to do balloon angioplasty, where you open up a blockage and then you put in a stent, all done through the catheters here. And then you can monitor, they have them on an EKG or telemetry, so that they can constantly monitor how the heart is electrically functioning while they're doing these procedures. So obviously for things like not only angioplasty and stents for heart attacks, but also in what's referred to as the electrophysiology lab or the EP lab, which is sort of a specialized heart lab where they'll do ablations for a condition called atrial fibrillation, where the heart is just beating erratically and too fast, and you can actually burn small areas of the heart that are electrically defective, if you will. And by destroying that electrically defective part of the heart, again, a microscopic level, then you can actually stop the atrial fibrillation from happening. That's a very common procedure. And then you also have pacemakers that are put in the EP lab as well. Another department would be endoscopy. This would be where the gastroenterologists are doing the upper endoscopies, which are referred to as EGDs, or the colonoscopies. Then, of course, there's the operating room, which again is mostly outpatient. And then you have inpatient surgeries for joints and spine, emergency surgeries like ruptured appendix, cancer surgeries like on tumors, coronary artery bypass graft, valve replacements like aortic valve replacements. A AAA is an abdominal aortic aneurysm, so that's a very significant vascular surgery that's performed on an inpatient basis. There's cardiac stress testing, so this is where the nuclear stress tests are done in the hospital. There's, of course, lab and then phlebotomists. So sometimes the nurses do their own blood draws, but typically they have specialized phlebotomists where all they do is go around drawing blood all day long. Now, there's also, of course, the pharmacy, and then there is the blood bank. Again, sort of similar to oxygen. Countless lives in America have been saved because of blood transfusions. And so all hospitals have a blood bank because you have to be like matched to the right type of blood, and it's frozen, and they got to thaw it. And so all of this, the blood work, and a lot of the medications, and the blood is actually transferred through the tubing system. And everybody who works in healthcare needs to understand the tubing system. So you can barely see it right here, but here's the tubing system. Here's how you transport stuff around the hospital. Now, sometimes people go around with carts, etc., but a lot of the stuff is transferred via the tubing system. And why is that important? Because stuff is constantly coming and going. You can both receive things and send things through the tubing system. And you like push a button for like where you want to send it to. Now, the problem with the tubing system is that things will sit in the tubes after they've been tubed to you. Let me give you two examples. Things will be tubed to the lab, and a lot of times they'll sit at the lab before they actually get processed. And for certain blood samples, if they sit for too long, for like a lactate, then you get an inaccurate reading. Likewise, a lot of medications are tubed to the floor, and they actually have protocols for how frequently the tubing system is checked. Or sometimes they don't have protocols over how frequently the tubing system is checked. So you can go by the tubing system and be like, oh, look, there's a tube with something in it that's been sitting in the tubing system for a long time. And I'm not saying anybody's lazy, but they're busy. And shoot, that could be a stat medication that the physician ordered electronically that they want the patient to be given like rapidly. And believe it or not, a lot of hospitals have protocols where stat literally means within 1 hour. So like, and a lot of doctors don't know that. They're like, oh, stat, that means they're going to get it right away. No, if the medication is not on the floor, it has to be tubed it has to be filled at the pharmacy, tubed to the floor. The nurse has to get it out of the tubing system. They got to give it to the patient. And like, that oftentimes does not happen within an hour. So honestly, one of the things that I would do is if I ordered something stat, I would then walk to the pharmacy, be like, I need this filled now. And they would fill it for me. I would walk it to the nurse on the floor and be like, I just ordered this stat. And typically it would be like an antibiotic for like a person who like just had their infection identified. And frankly, their heart rate was kind of high, their blood pressure was kind of low, and they were becoming septic. And so the sooner you got in those antibiotics, the better. I'd be like, look, you need to hang this now. Like unless you got an emergency going on with some other patient, like I need you to hang this right now. And I'd be nice about it. But just know that, again, from a process perspective, there are major breakdowns constantly. Again, it requires the heroics. I'm not saying I'm a hero, but it requires the heroics of the nurses and the docs and the techs to constantly make up for these breakdowns in processes at the hospital. All right, moving on. Patient room, departments, and of course, nutrition, the food. We got to talk about the food. Now, the important thing about nutrition is the lack of nutrition, what is referred to as an NPO, nothing per oral, or none per oral. Patients are kept NPO and cannot eat constantly at the hospital. So you want to talk about hospitalization? Let me tell you what hospitalization is all about. Hospitalization, you constantly get interrupted, you can't get any sleep, and you can't eat. And we wonder why the elderly patients get delirium in the hospital, okay? So this is not as much of a big deal for younger patients, but it's very, very common for the elderly to have an altered mental state where they get confused. And I literally saw a guy once who constantly thought that his call bell was a fishing pole, and he would literally throw his call bell across the room because he was like casting because he thought he was fishing. And oh man, now we're getting spammed. All right, so forget this. I'm gonna try to block this particular user, so I apologize about that. All right, now, so just know that people are often hungry and sleep deprived because they're kept NPO for various tests and procedures, and like if what happens is okay, your tests or procedures in the afternoon. Well, you're kept NPO after midnight, which means you go from not eating anything, let's say at 8 or 9 p.m. till like 3 in the afternoon, and it's very common for your test or procedure to get canceled. So there you go, and you've waited all day and you can't eat, and then like you got to go through it all over again because they move it to the next day. So it's miserable. All right.
Socorro, acontece mesmo isso, é? Jesus.
Tem que aprender, hein?
Hã?
Aprender tudo isso, né?
Acontece, eu achava que não. Eu achava que era só aqui no Brasil.
Oxe. Então, esse vídeo vou jogar na grupo para você copiar. Você pode assistir esse vídeo depois, de novo. Okay? All right. It's just to give you an idea of the different departments. All right? Let's go. All right. Vou deixar Marcela e Elaine. Okay. Elaine. Elaine? Ela foi? Elaine? Okay. Marcela.
Hello.
Hello. Okay. Caiu a minha conexão. Ok, você fala a conexão dela caindo. Ok. Leia para mim, Marcela. Aqui. Vamos lá.
Emergency Department.
ED.
ED.
Uhum.
Out
area,
area for
urgent. Mhm,
and emergency care.
mhm. Professional use,
Triage,
triage,
triage and stabilization.
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 Isso. Next.
Intensive care.
Unit.
Não sei. Hã?
Unit.
Unit.
É da português ICU. Esse é Intensive Care Unit. ICU.
ICU.
Isso.
Unit
Unit.
for critical
Unit.
inpatient.
Unit.
Unit for critical.
Critical.
Critically
Critically ill.
Critically ill patient.
Patients. Continuous.
Hã?
Continuous.
Continuous monitoring.
Próxima. OR.
Operating room.
Operating room.
Operating room.
Definition.
Surgical
Surgical.
procedure. Is
Procedure.
procedure.
Area. Pre
and post op care.
Very good. Próxima.
Medical. Eu não sei.
Surgical.
Surgical. Unit.
Unit.
O U tem U, né? Unit.
Isso. U é pronúncia tipo Y. Unit.
Tá. Unit.
Uhum.
Isso daí é inpatient, é isso?
Inpatient.
Care unit.
Isso. Professional use.
Routine.
Hospitalization.
Hospitalization.
Próxima.
Esse radiologia, como é que fala?
Radiology.
Radiology department.
Definition.
Imaging
services. Professional use.
Diagnostic
exams. Very good. Próxima.
Laboratório. Diagnostic.
Testing.
Area. Sampling.
Analysis. Próxima. Pharmacy.
Medication.
Preparation. And dispensing.
Esse aqui não é medication, não, né?
Medication.
Ah, tá. Medication
Safety.
Nursing station. Central nurse
Work.
Area. O A tem som de E, né? Area. Coordination.
And charting. Very good. Coordination and charting.
Coordination and
Charting.
Chart.
Charting.
Chart.
Mhm.
Recovery room.
Recovery room. PACU.
Recovery room. Post anesthesia care.
Post anesthesia.
Post anesthesia care.
Unit.
Ai, meu
Area.
Deus.
Area.
Area.
Uh-huh.
Post-op, é isso?
Post-op.
Post-op. Monitoring.
Monitoring. All right, very good. All right, so area department definition, professional use. Emergency department, ED or ER. All right. It's the emergency department was supposed to shama ED or ER. Emergency room. Okay. Area
Okay.
of urgent and emergency care, which would deal with triage and stabilization. ICU, intensive care unit, unit for critically ill patients, which requires continuous monitoring. Operating room, ORs, surgical procedure area, sterile area, pre and post operative care. Medical surgical unit, inpatient care unit, routine hospitalization. Radiology department, imaging services, diagnostic exams where you do x-rays, MRIs, all these things. Laboratory, diagnostic testing area, where samples are analyzed, analysis. Pharmacy, medication preparation and dispensing area, medication safety. Nursing station, this is a central nursing work area where the nurses coordinate and do charting. Recovery room, where after operating, after surgery, we do post anesthesia care area, post-op monitoring. Everybody understand the definition?
What
Okay.
is charting?
Charting is where you record whatever is happening with the patient.
Seria
You write-
prontuário?
Yeah, it's like you're monitoring the patient and you write down whatever medication you on the patient's chart. All right, charting is where you monitor the patient's chart. The chart is like the I don't know what you call it in Portuguese, but all the information about the patient, what the patient is doing, the history of the patient.
I think it's prontuário mesmo.
It's prontuário mesmo, isso é sempre.
Teacher, I don't understand the difference between operating room and medical surgical unit because both is about surgical, but
Okay, so the operating room is the area where the surgery is done. All right, the operating room is the area where the surgery is done. Medical surgical unit, after the surgery, you're taken to a specific area where people with the same surgery are dealt with.
so I
Inpatient.
understand that the patient go to recovery room
No,
after surgery.
recovery is directly after surgery. You don't just take the patient from surgery to the medical surgical room. You have to observe the patient after surgery for the patient to come out of anesthesia. All right.
Mm-hmm.
You have to observe the patient right after surgery. You put the patient in what you call recovery room.
It's like RPA, recuperação pós-anestésica.
EC.
So what is medical surgical?
Medical surgical. Say, for instance, you did a hysterectomy, just for argument's sake. You're going to be taken to a unit, or we say ward, where there are medical surgical procedure, a ward, WARD. This is a ward where general surgeries were done, and now you're in this area to be cared for. You take it to a general surgical ward, medical surgical ward.
Okay.
So for instance, you wouldn't take a patient with a neurological surgery to a medical surgical ward. You'll take that person to the neurological ward, where a specialist deal with that patient. General surgery, other surgeries that are, not specialized, they're taken to a medical surgical unit. So the procedure is, as I know it in England and Jamaica, surgery, right? Then you go to a recovery room. After recovery, this is post-anesthesia. You're observed after anesthesia. Then when you're fully recovered, you're transferred to, depending on the surgery, you're transferred to a medical surgical unit.
Okay.
All right? It's confusing because it's different in Brazil. It's different in Brazil. It is very different in Brazil. I know because I've seen it and I've read about it. All right? So if you are a nurse, say for instance, you're a surgical nurse, you assist the doctor, all right? Now, after surgery, the patient is finished, sutured. You take the patient to recovery room, all right? Because the patient is still under anesthesia. Excuse me, right? You take the patient to the recovery room to recover from anesthesia.
So is the surgical after recovery room and after medical surgical unit?
Exactly.
Okay.
Exactly. You understand? That's how
Eu
it
tenho
works.
uma dúvida.
Yeah.
Infectologia em inglês seria infectology or infectious diseases ward?
Infectious disease ward.
Okay.
Excuse me, guys, I'm coughing. Let me turn off the fan. Oh, this cough. All right. Okay. So this is the procedure. All right. But this one is the same as ER. Emergency room, emergency department, medical question. Okay. All right. Any other questions? No. All right. Brenda, number 1.
Oh my gosh, the
Yes,
patient was admitted through the teacher, I don't know.
Look at the burn. Admitted.
Okay,
Was it-
so the patient was admitted through the admission department.
No.
No,
Mhm.
I don't know, teacher. I don't remember. Okay, so it's emergency department.
Thank you.
So
Thank
the
you.
patient was admitted through the emergency department.
Very good. Very good. Caroline, number 2.
Post-operative patients are monitored in the recovery room.
Mhm.
Yes?
Yes.
Okay.
Victoria, number 3. Victoria, chocolate lady.
Just a moment. Number 3.
Uh-huh.
Imaging exams are performed in the radiology department.
Thank you, my chocolate lady. Carolina, number 4.
Medications are prepared and dispensed by the pharmacy.
Thank you, Carolina. Andrea, number 5.
Critically ill patients are transferred to the intensive care unit.
Thank you very much. Guys, you are the best. Emergency, recovery room, radiology pharmacy, intensive care unit, and our grammar focus. Any questions so far? Any other questions? No. All right. I have 9 minutes and I want to explain these prepositions. Preposition of place and movement in hospitals. Prepositions are used to describe where patients are and where they are going. Common prepositions: in, on, at, to, from, into, through. Common, these are the most common ones. All right. Where is the patient? The patient is in ICU. And why prepositions are so hard for Brazilians is because most prepositions have just one word. In Portuguese, they have just one word. For example, you just say, onde esse paciente? Ele está dentro da ITU. Huh? The patient is in intensive care, or you can say the patient is at intensive care. But why not? At does not move. All right. At never moves. I live at this address in Jakarta. All right. The patient was transferred to the radiology department. Oops. The patient arrived through the emergency department. All right.
Pode ser arrived in.
No. Because think about it. Andrea. The patient came to the hospital in emergency, passou com triage, para outro departamento. So, we use through, okay? The patient passed through that department, passed through emergency to whatever department. You understand?
Yes.
Make sense?
Yes.
I
Right.
don't understand. I agree with you, Andrea. I thought I can use the arrived in the emergency.
All right. So, that's why I said prepositions are so very confusing. So you arrived in the emergency department. You arrived at the emergency department, right? So if you arrived in the emergency department and you did not go anywhere else, you arrived in the emergency department and was treated and you were sent home, right? That's right. Você chega na emergência,
Uhum.
faz tratamento no interno, você volta em casa. Certo? Então, você chegou na emergência para outro departamento. Você passa through. You pass through emergency to, ok? Obrigatório. Você chega no hospital. Chegou na recepção, cadastro, né? Depois triage, depois para médico.
So I just use in if I stay in this department. Like
Yes.
I arrived in ICU. I in ICU.
Right.
If
So you came to the hospital unconscious, boom, directly to ICU. Diretamente para ICU.
uhum.
Entendeu?
Aí I can use in.
Isso.
Okay.
Arrived in the ICU department on Wednesday. Okay. So if you went through another department, all right. So for example, I arrived at the hospital and I went through triage. Você passa com triage. Certo? You use through. Porque você passa para outro departamento. Você usa through. Entendeu? Usa esse. Ok? Todo mundo entendeu? Tá explicando?
I understand. No.
All right. Tomorrow, I'm going to stop here. Tomorrow. Okay? We're going to finish this. All right? Because I need to show you the preposition. Amanhã vou terminar esse aula. Isso é muito importante, preposition. Ok? Amanhã vou terminar esse. Vou explicar mais. Vou jogar um vídeo para você entender melhor. Ok? Eu joguei vídeo de departamentos. Agora, amanhã, vou jogar esse vídeo para preposition, movement and place. Tá bom? Ok, gente? Any questions? Let's leave it here until tomorrow, okay?